Hey, this is Dr. Lee with Infinite Athlete Physical Therapy and Performance. Today I want to go over some self-mobilizations for the hip. These are some really valuable techniques that can help to decrease hip pain or even relieve it altogether. So before we do that, I want to just take a closer look at the actual hip joint and explain the purpose of why we do these exercises. So if you're looking at the hip joint, you basically have a convex ball inside of a concave socket. And so whenever you're moving that hip joint through space and through motion, that ball should actually glide in the opposite direction that the hip is moving. And so that's the movement that we're trying to facilitate with these mobilizations. And we do that through a technique that we call mobilization with movement. So we're going to show you some of those today. So this first technique is called lateral glide with hip flexion. This is a great technique to use if you have tightness at the end range of hip flexion or any pain at the end range. It can help to relieve that. So in order to do that, go ahead and step inside of a band and bring it out until there's good tension on the band. Place it as high as you can on your hip joint. And then from this position, what you're gonna do is sit back on your heels. Okay, hold for about 5 to 10 seconds and then return to start. Try to repeat this exercise about 10 times before moving on to the next one. So the next exercise is a good one that helps with hip internal and external rotation. If you have any tightness or pain at the end range of that, this is a very valuable technique as well. So the way it starts, again, you step inside the band, and this is gonna be a lateral glide, so you should be pulling your hip directly out to the side. And so from this position, with that knee down, all you're gonna do is rotate actively all the way to the inside with the foot, and then all the way to the outside. Okay, if you get any pain or tightness with that, you can even step out a little further, get a little more tension on the band, and same thing. So we're gonna try to repeat and do 10 of these. So this next one is a very valuable exercise, especially for squats. It can help unlock a little bit more range of motion at the bottom of your squat, or if you have hip pain with your squat. So in a position like this, if you have hip pain on one side, this is a great technique to use. So in order to do it, you're gonna go ahead and have a lateral glide with the band. So we're gonna step inside the band, place it high on the hip, and bring it out until there's good tension felt. From this position, straighten your opposite leg and rotate the involved hip to the inside, the foot to the inside, and you're just gonna sit back on that hip. So you should feel a stretch in the back part of your glutes with this one. And so if no stretch is felt, you can even come out to the side a little bit and just find those tight corners and hang out in that position. And try to hold for about 5 to 10 seconds, and then relax, give yourself a break, and repeat this exercise about 10 times if you can, before moving on to the next one. All right, so this next exercise is called an anterior glide with hip extension. This is to help improve any tightness or pain that you're having at the end of hip extension. So as you're kicking your leg backwards, if you're having any tightness or pain, this is a great technique for you. So the way it'll look, you go ahead and step inside of the band. And so on that same side, that leg is gonna go down on the ground. Bring the band as high as you can on your hip, on the back side, and slide back until there's good tension felt on the band. First thing you're gonna wanna do is sit up nice and tall, rotate your pelvis backwards. And so from this position, just gonna lean forward slightly. It doesn't take a whole lot to get a stretch. You should feel a stretch in the front part of your joint capsule here. And then relax, take the tension off. So try to repeat this exercise for about 10 times, 10 repetitions if you can. And then recheck your hip extension afterwards and see if it's any better. All right, so the next exercise is called long axis hip distraction. This is a great technique to use, especially if you get pain with weight bearing. So if you're up and standing and putting more weight through your hip and that increases your pain, this is a great technique to use. Basically with long axis hip distraction, we're pulling apart the hip and giving more space inside of the joint to help decrease the pain and decrease the friction of those joint surfaces. So here's the technique. You can go ahead and sit down on the floor or the ground and wrap the band around your foot from underneath and then cross it at the top, just over your foot. And so from this position, go ahead and scoot back until there's good tension felt on the band. And this is gonna be a static hold, so we're not gonna do repetitions with this one. You're just gonna lay back, turn your foot out slightly, and just lay here and relax for 1 minute. Now, after a minute is up, go ahead and scoot up, just take tension off of the band, rest for about 15 to 20 seconds, and then repeat the same exercise again, holding for another minute. So give that exercise a try and see if that helps to decrease some of the pain and the compression in your hip joint. So the next mobilization is a great technique used for hip impingement. It can also be used to address hip internal and external rotation tightness. So the way that technique looks, go ahead and get in a half kneeling position, take your band and place it high on the hip and scoot out to the side until there's a good pull on the band. Place one hand down on the ground, one hand on the outside of the knee, and we're just going to rotate that hip inward just like that. You should feel the stretch on the inside of the hip. So another cool thing you can do is press that knee out to the outside into external rotation. And in this position, go ahead and squeeze your glutes. Get nice glute activation there. That will help to improve your glute activation during your squats and can help improve your squats as well. So try to hold for 5 seconds each direction and repeat 5 times on each side. So that is the hip internal external mobilization with lateral glide. For more mobilizations or exercises, please subscribe to our channel. Thank you for watching.